I'm very passionate about pelvic health, and it affects all of us. I think it's super common that we think it's just for pregnancy, it's just for postpartum, it's just for a female pelvis, and that is so not true. So, did you know incontinence during pregnancy is a predictor of experiencing urinary incontinence later in life? That'd be like the stress urinary incontinence, the coughing, sneezing, running, and getting some leakage. This one I found really interesting. Incontinence is the second most common reason after dementia for admission into assisted living. 20% of women change or minimize their level of activity secondary to that stress incontinence. So that's the one again with the running, sneezing, laughing. And then the fecal incontinence, although this is quite a range, occurred in 2 to up to 24% of adults, but we still think it's quite underreported. So many people have symptoms of something. This is obviously a little bit harder to bring up. It's not your typical table talk where you talk about back pain and shoulder pain, and so it's just not something that we discuss often and often goes underreported. So the big question, why are we here today? To dive into what a Kegel actually is and how to do it, how to lengthen the muscles, and then talk about pressure. This is Dr. Kegel. This is the person that started Kegels and why we all know the name. This was in the 1940s that we wanted to find something to help with incontinence, so we created the Kegel. So I want you to try, although it's not the easiest thing to just verbalize some of this, I do want to give you the proper cues to be able to try it. There's 2 different kind of muscles that we aim to activate, whether it be the front or the back of it. So one would be to shorten the penis, kind of pulling back, or imagine that you're stopping the flow of urine. Okay? So try that, and what you want to make sure when you're doing it, like uncross legs, sit up nice and tall.
Standing or sitting?
Doesn't matter. Whatever you like. So you should feel everything starting to pull up. It should not be a big movement. If I look at someone and they're like squeezing everything or lifting up on the chair, we've gone way too far. I usually tell people, if you're standing in line somewhere and I'm standing behind you, I shouldn't know that you're doing it. Okay? So it's a tiny little lift, and you should just feel the opening kind of come up, or penis pull back. If penis is pulling back, you should feel the testes just lift a tiny little bit. And then for the back part of it, it's just super rectalis. You want to be able to tighten around the anus. So imagine that you're stopping the release of gas. Okay? You want to be able to do this, but then you also want to be able to actually let it go.
So if someone can do it and they can feel it happening, that's a good sign?
It's a good sign. You should feel it happening, and you should feel front and back. It shouldn't be one or the other. The muscles, they're all really close together. There's a thin little sheet of muscle separating front to back. So when you're getting the anus, you should still feel a little bit into that front activating, and vice versa. One thing I say, if you go on to good old Dr. Google, Kegels are not a one-size-fits-all exercise, so we don't all have to be doing Kegels, okay? Just like we all don't have to be trying to get the world's strongest squat or whatever. These are some reasons that we might not want a Kegel, potentially later on, but not right away. If you have a really tight pelvic floor. So if someone has quite a bit of pelvic pain, we don't know for sure unless we assess them, but there's a chance that they might actually have a pelvic floor that's really on and they can't shut it off. And so if someone goes and just does a ton of Kegels every single day, they might just make their symptoms worse, because it's really good for the pelvic floor to be able to turn on, but if they can't get it to shut off and they're just doing on, they might just exacerbate symptoms potentially. And then pressurized abdomen. So we're going to get into this one here, but a good analogy I have of this one would be someone who's doing weightlifting. Maybe they're going quite heavy in the weights, and every time they lift, they leak. So what I can see is that you can have a really good pelvic floor activation. They think they're weak, so they do a ton of Kegels and nothing changes. And then we assess them, great activation, but as soon as they activate the core, and everything just pushes right down into that pelvic floor. And so that's someone that we have to go and manage that intra-abdominal pressure, and not so much just work on that pelvic floor strength. So we need to get a length in it, and this is something you could do every day. So a couple different ones, and I want you to try these ones here. You can close your eyes, you can do whatever you kind of like, but as you inhale, okay, imagine that the sit bones are just spreading wide, and your tailbone's just floating a little bit. Okay, so just lengthening it out. When you do this, just make sure you're sitting in good posture, legs are kind of equal. You can also think of your hips just gently melting apart. These muscles attach directly into the actual hip joint. So you can just try and think, imagine this just drifting apart. You don't want to put pressure down there. So if you feel like you're straining, you've gone a little bit too far. Try it for a second. I usually find this one's a little tricky because it doesn't give you a huge feedback like a Kegel does, right? You're not like, yeah, I can really feel it. If you have difficulty doing that, sometimes you can do a tiny little Kegel, like you're just trying to lift, so your brain's like, oh, that muscle, and then let things go and melt apart a little bit. It's really hard to feel. Yeah. So once you get to do this quite a bit, you will get that feedback, but right now our brain doesn't have that strong connection at the start because this is a brand new area for many of us. So once that kind of builds, and you do more of these, it does feel a lot more relevant for us. You want to be able to feel that let go. You take it from like neutral to just full relaxation. I want you to try these. The first one is the butterfly stretch. So you can do this one technically in sitting, but I find this one lying down is a lot better just because you can open up the hip angle a little bit. When we're doing this one, you want to think of being able to lengthen your pelvic floor. Some of the muscles attached to the hip joint, and some of them are short and just stay in the actual pelvis. Imagine now that your sit bones are just gently spreading apart, tailbone's just floating a little bit. You do want to ideally keep pelvic back on the floor. I just don't want you to be like super round. This one would be one that I would recommend doing, honestly, every day if you can. We don't realize like how much tension you even hold just in our hips and our pelvis, but holding for at least 30 seconds, even going up past 2 minutes is pretty okay. This can be tricky if there's already osteoarthritis and other things in the hip. You can also try putting a pillow or a towel underneath the hip that's sore, like on the side to stop the leg from coming out, because you're still going to get that stretch. This is your max stretch. Other one is a happy baby stretch. There's some modified versions of this too. Named after those babies that are playing with their feet when they're really little. The full version is that you bring your knees back and you hold inside your feet. It's a modified version of this, and that would be holding behind the actual knees, one arm per leg, and holding like the knees out towards the shoulders, kind of an angle. And if at home you have a towel or a strap or anything like that, but I'm also use that to hold it. Same thing in this position. Imagine that you're just lengthening pelvic floor, sit bone spreading wide, tailbone just starting to float a little bit, or the hips just gently melting apart. Should feel comfortable and not like a strain.
Are you contracting or just releasing?
Just releasing. These ones you can definitely do every single day if you like. These are really good ones. I'm going to teach you how to do a core activation, and then we're going to do it with a couple exercises. You can do lying down, you can do sitting up, you can do standing, really whatever works better for you right now. You're going to start with a pelvic floor activation. So start with that Kegel. Typically, I would say stop the flow of urine. Okay, it's the best one to start with. And this is anytime someone tells you to activate your core. You're at the gym, you're doing a workout, you're thinking about doing any type of movement, you're going to start with that pelvic floor activation. Then you want to think of a low belly lift, and then finally belly button coming back to spine. Okay? When we usually think of core activation, a lot of us typically will think of the belly button and just pull everything in and brace a little bit. But we really want to engage that lower pelvic floor with it, so we always get that nice scoop up. It's almost like a zipper coming up. Okay? And then we're engaging the floor with it. So the activation with exercise, we're going to try a squat and a glute bridge. Anytime that you do something that is work, that is something you have to actually engage for, you should always activate your core with it. And that includes pelvic floor and the abdomen. So let's start with the squat. You can do it to a chair, you can do it standing, whatever you like. You don't have to go deep. 2 options of how to activate here. You can either start with standing. You can start that Kegel, take the low belly lift, and then pull belly button to spine. Okay, hold that. Go down into the squat, keep it, and come back up, let everything go. If you start to feel it let go a little bit while you're doing it, that is completely okay, but we should feel that we start every time trying to engage these muscles, okay? The other option is you keep everything relaxed at the top, you drop down, at the very bottom, you get that Kegel core activation, and come back up. I find this was a little bit trickier to do, but that is still an option. It's completely okay to do either one of those. So try it here. I would say let's start with the one where you activate at the top. So start with the Kegel, pretend you're stopping the flow of urine. Low belly starts to lift, belly button to spine, so you're picking everything up and back. Hold that, make sure you breathe, and then drop down into your squat, keep it as best you can, and then come back, let everything fully relax. Okay. The other option, you can try it, see which one feels best for you. Keep everything relaxed, drop down, Kegel, engage core, stand back up. The other one is glute bridge. Try to have your knees bent for this one, if you can. So keep your arms at your side, hands on the ground. So here, start with that same activation. You're going to start with your Kegel, pretend you're stopping the flow of urine. Get that low belly to lift. Think of it now coming up towards your head, not up towards the ceiling. And then bring belly button to spine. Hold that, don't hold your breath. And bring hips up into the air. Try and hold it for a few seconds before you slowly lower it down. It should almost be like a straight line from the shoulder up to the knee. So you shouldn't be sagging a little bit. If you feel it into your low back, you just haven't gone up high enough. You can hold it slightly longer, but usually 3 to 5 seconds is plenty. 5 seconds is a nice goal if you're able to do that. So you come up, you keep the activation as you're coming up, and then you fully relax and lay down. So you engage before you can lift. You make sure you're still breathing, and then slowly relax everything, come back down into the mat. Yeah. So think of this like anytime you're going to do anything hard, like you're going to push something heavy, you typically wouldn't just push it and not try and activate your core.
Let's say if you're doing like a shoulder press, you could do this too.
Yeah, absolutely. Yeah.
Even though it's way up there.
Yeah, because even if you're lifting over here, you're still putting pressure downwards. Imagine that you're going really heavy, right? If you're going really heavy, you're using everything else down here.
How about bench press?
Any of those. Any movement that you would do in a gym setting, even a bicep curl, like it could have nothing to do with your actual pelvic floor that you're exercising. So you always want to have that core and your pelvic floor, everything engaged coming up, so that when we're bringing that weight up, nothing's pushing down into the pelvis. Okay, but if you're doing this and say you're doing 10 repetitions and at 8, 9, and 10 you don't feel your pelvic floor anymore, but you're still trying to engage every time, that's totally fine. Your muscles might fatigue just like every other muscle in our body, but just as long as you're thinking about trying to activate it every single time, it doesn't have to be perfect. So this is that impact of pressure that I was talking about. On the left, this is what should be happening. We go ahead and activate, pelvic floor has a nice lift, belly comes in, back, everything's just lifting up. So this example is using holding breath, and if we hold our breath, you can feel right away that pressure pushing down. And so what we want to make sure here is that pelvic floor at the bottom is not super happy when we just push everything right down into it. And this is when it doesn't matter how strong this floor is, if we just go ahead and put pressure down into it, usually what we'll see is if someone's activating and they only engage the upper part of their belly, there's nothing down here. And sometimes people will say, I'm trying to do so many exercises that target my lower core and abs, and nothing is changing down here. And it might be because we're so dominant up here that you might not actually be weak down into your lower abdomen. It might just be that the brain is prioritizing this upper belly, and we need to change that strategy a little bit. And it's not that pressure right now is going to cause harm, but over time, and this could be years, this could be 2 years, this could be 20 years, but over time, there is an increased chance of being symptomatic if you have any leakage already, or if you have a hernia or a prolapse. It doesn't actually lift up at all, it just wants to push down.
So you mentioned hernia, which is basically the balloon pops up the groin a bit, right? If they had a stronger pelvic floor and engaged that, it might have helped.
Yes, so if someone comes in for an inguinal hernia, especially if it's, really doesn't matter if they're going surgical or not because they need a good strategy regardless of that. But if their concerns are hernia and they're always engaging that upper core and they have that pressurized strategy, they are going to be symptomatic for a while. And even if that is someone that is going for surgery, we want to make sure that we change that strategy because otherwise they could be coming back for that surgery again in some time because we haven't removed the actual potential cause of that. So there might be other things internally that the surgery will fix for that, but we need to change that strategy. Otherwise, they're just going to continue with that for a long time. So this is a study that was done in 2010, but they're looking at the impact of these postures here. Okay. And so they're considering this when they're neutral. So they found that the hypolordotic posture, so we use that lumbar curve, was one that was actually the worst in terms of creating pressure down into the pelvis. So try a couple different things. Start standing, okay? Stand in good position, like kind of neutral. Think of your hips being underneath the body, underneath the shoulder. And just try to get your core activated, get that kegel, get the belly button spine, and then let everything go. Now I want you to push your hips forward, and now try to do your kegel in your core. It is so much harder to do. So this is just the impact of our day-to-day. If we're hanging out, we call it hanging out in the hips a little bit, where those hips push forward a tad. If that's our day-to-day, the pelvic floor underneath, when you do that, you can already feel the glutes squeeze a little bit, right? And so our pelvic floor is just sitting there tight and sitting in that more like shortened position. The muscles aren't physically short, but they're already in that shortened position. So when that's happening, if someone does have a hernia or a prolapse or incontinence or just any kind of symptom or back pain, this is one that we would want to work on. It doesn't have to be a perfect posture, but if I say, if you're standing for prolonged periods of time, even if you're standing in a really long line at the grocery store, just think, okay, how am I standing? Am I standing like this where everything's pushing forward? If so, I say put your hands on the front of your pelvis, which is where you should feel your hips, okay? Push your hips all the way forward. You'll feel that area tighten underneath your hands. Bring your hips back until you feel that tension go away. So that's where we ideally should be standing, and sometimes it's quite surprising. The opposite would obviously be pushing out a little bit. You don't see that one as common in practice, but that one also, for other reasons, you'd be tightening pelvic floor just the opposite way. So we really want to make sure that everything's kind of nice and here and engaged, and anytime we do a movement, we're always starting with that, for sure. We're going to touch into the bowels a little bit, and we're going to talk about pooping positions for a second. So toilet posture, this one sounds really silly, but it is so important. So many times people will come in and say that I'm here for my bladder or my hernia or core. We don't need to talk about my bowels because it has nothing to do with it. It's not even close to it. It is so closely related and sitting side by side to each other. And so if you have something going on with the bladder, there might be other things with the bowel and vice versa. So toilet posture, most of us are just kind of sitting or relaxing or rushing, whatever we're doing. But this is the ideal position here, okay? So your knees should be higher than your hips and feet sitting on a stool. Does not matter what stool, a little toddler kid step stool, like those are perfect. Knees are sitting slightly apart. So a lot of times we pull our pants down and we come in the mid-thigh, but then you can't get the knees apart, okay? Pants come over down. And then elbows on the forearms or knees, just kind of like resting forward, and then making sure that we're not slouched over. So really making sure that this angle here is nice and straight, okay? Slouching is just causing that downward pressure on the pelvic organs. So if we think of that balloon analogy into here, if we just push everything down like this, and even though we're not doing any type of activation in this, we're shortening everything up, and it just pressurizes down below. Specifically, if the client has a prolapse or a hernia. This could make them symptomatic, especially if you add the straining. And some people do both of these at the same time. So the straining is just that breathing in. Okay, we should never strain with a bowel movement. If we have to strain, come back later. It's not the right time. You shouldn't be sitting there for a super long time. This is just when the contents of that pelvic floor and everything just become compressed. So if you do have any symptoms of anything, even back pain here too, you could be making yourself more symptomatic. You might not be causing a ton of harm in that time, but you might be feeling it. Okay.
So let's say someone's got a busy day and they're always going to the bathroom, pushing the poo out quick as possible. That's not necessarily good.
No, you don't want that. And sometimes your body learns, so that's the only way it happens. Same with our pee. People do push their pee out as well. They're like, okay, I got 2 minutes, let's go. And they're like pushing down to get that pee out. We do not want to do that. We can change the strategy with emptying, but it also does create that pressure down into our pelvis. This is a squatty potty that you're talking about. It doesn't have to be this thing, but this is the picture on their website. It's super cool. And it's this is the puborectalis muscle coming around it. Okay, it's just looped around from the rectum. And so when we're sitting just normally with a stool and feet on the ground, this is the angle. So trying to get that stool out, it's coming around this little hill, you could say. Whereas with squatting, with that feet straight up, just like I showed you in the previous slide, we have that nice straight angle coming down. Okay, so we want to be able to eliminate nicely, and this does make a difference. So highly recommend getting something to put your feet on roughly about that stool height.
One question is, I've actually heard from a urologist that for men, it's better for their prostate and urine flow to pee sitting.
Yes.
Do you think?
Yes. So
because of this angle right here, right?
That's exactly right.
If your legs are totally straight, you're tightening it all out.
And what I usually see is not just straight like this, and this is something that we kind of work on, is that you're peeing, especially if you're in public or at a urinal, because we need to reach everything to the actual urinal in front of you or the toilet, we push the hips forward. But remember, we just tried that and we pushed everything forward, everything gets tighter. So now try and release the urine, right? We need things to be able to be relaxed when we're letting it go, not tense. So it kind of contradicts and works against itself. So yes, the best thing you can do is actually sit, but also just trying to change positions instead of just always pushing the hips forward. Maybe if you're at home leaning forward, you can be putting your arm out or something, but changing that up so we're not always just pushing everything forward and tucking everything under, or just standing closer to the toilet. So those are the big things that I wanted to go through today, the kind of the big topics. I think the key takeaways, obviously, don't ignore the symptoms of anything. I think it's so important that we go and get things looked at because it's just as important as your back pain or headaches or any other thing that we want to get to. And it does impact our overall health, even though we think it's just my bladder, it's just my prostate or whatever it is. We can see how that is so related to the rest of the body. And oftentimes I'll have clients that come in that won't take their grandkids to the movie theaters because they can't sit through the movie and not leave the entire time. So they don't go. I have others that have had a radical prostatectomy and they'll go health-wise and doing better. Quality of life is severely impacted because they might be leaking quite a bit and so they can't either return to work or they can't go golfing and enjoy the activities with their friends. So these are really big things that we want to touch on. You don't have to be doing these Kegels every single day, but I would recommend just learning how to activate it, fully relax it, and just make sure we're not gripping there all the time, and just paying attention to the toileting posture and our actual posture ourselves, especially when you're staying for a prolonged period.